Hi, I'm Dr. Chris Kammer, and I'm a dentist based in Middleton, Wisconsin. And today I want to talk to you about canker sores. It's a huge problem for 56 million Americans. Here are the facts, folks, on canker sores. Like I said, 56 million Americans get them regularly. Women get them more frequently than men. Canker sores are tiny little sores on the inside of your mouth, and they hurt a lot. You know this. Eating or drinking can make them sting like crazy, and they can even make eating or talking very difficult if you get a lot of them. So, it's possible to get more than one at a time, and that's a huge annoyance in your mouth. In fact, it almost incapacitates you. Now, those little devils can easily last up to 3 weeks. Canker sores, they're a problem. This is hurting me to even think about canker sores. So what actually is a canker sore? Well, canker sores are painful sores on the inside of your mouth with a white or yellow color. They can be on the inside of the lips, they can be on the inside of your cheeks, they can even be on your tongue. Man, there's nothing worse than having one on the tip of your tongue. Ouch, I hate that. Canker sores are also called mouth sores, and if you're a scientist, you might even call it an aphthous ulcer. Yeah, remember that one. Now, we really don't know what causes canker sores. Most of the population, like I said, get them regularly. Like I said, that's 56 million adults. And canker sores can last up to 3 weeks. Way too long. Most treatments simply numb the pain for a little while. However, only one treatment has the clinical studies showing that it heals sores in as little as 24 hours. Yeah, see, canker sores normally heal in about 2 to 3 weeks, so doesn't 24 hours sound a lot better? Now, don't confuse canker sores with cold sores. Cold sores usually appear around the mouth or lips, while canker sores are going to appear inside the mouth. Anyone can get canker sores. Women are slightly more likely to get canker sores than men. Some people have 1 or 2 episodes a year. Others almost continually have problems with canker sores. And did you know that people spend about $150 million a year on canker sore treatments? That's a lot. It's a really big problem. So what causes canker sores? Well, there's really no one thing that causes a canker sore. You almost have to try and figure out if there's anything that triggers canker sores in you. Now, here are some of the possible triggers you might want to look into. Sometimes it's as simple as maybe just even biting your cheek or something that creates a tiny little break in your tissue, like even nacho chips or something. Just cause a little scratch on the inside. That could be the entry point for the bacteria that might cause a canker sore. Also consider that stress is a factor as well, and they may be triggered by a reaction to chemotherapies, or lack of vitamin B12, folic acid, or iron may also contribute to this problem. And GI problems. Yeah, your gastrointestinal situation could contribute to canker sores. Getting your period, or even certain food allergies. So some people who use toothpaste with the ingredient sodium lauryl sulfate, remember that ingredient. Sometimes it's written as SLS. These people are prone to get canker sores too. Make sure your toothpaste is SLS free. And toothpastes that are SLS free usually make a big deal about it on the label. Watch for that. But what about treatments? Most canker sore products are typically just topical little pain relievers that numb the pain. That's a treatment, I guess. But as anyone who's ever had a canker sore knows, they only work for a little while, kind of moderately well. And you've got to apply it again and again to really have it be effective for you. Now, there are liquid gels that form a film over the sore, but they don't really last very long, and a good hot drink will make them just melt away. Now, a few products contain antibacterial agents primarily used to prevent secondary infections, which are really rare in the case of most canker sores. Now, of course, none of these products speed healing to any significant degree, but that has changed with Canker Cover, because Canker Cover provides complete pain relief and total protection from food and drink irritants for about 8 hours, and it heals most sores within 24 hours. So again, the typical treatments for canker sores are liquids, ointments. They've usually got a little topical pain reliever on there like benzocaine. However, they only stop the pain for a short amount of time, and so they have to be applied over and over again, and that can become annoying too, sometimes every half an hour. Many taste like chemicals or alcohol, not so good. And they don't protect the sore from the irritating food or drinks that you might be consuming. So certainly it would be nice if they would speed healing in any kind of a significant way, but these typical treatments don't. Only one treatment, called Canker Cover, has clinical studies showing that it heals the sores in as little as 24 hours. So take care and keep smiling.